Hi, my name is Chanel Hamilton, and I will be doing catheterization. Hi, Mr. Smith. I'm Chanel. I'll be your nurse today. Is everything okay? Okay. I'm just gonna do a little hand hygiene. Check the order. Yep, you're getting catheterization today. Are you experiencing any pain? Nothing's going on? I'm just gonna check your ID. Make sure you're Mrs. Smith. Okay? Yep, you're Mrs. Smith. Do you know your age? Any developmental limitation? No? Okay. I'm just gonna provide a little privacy for us. Close that. And I'm just gonna elevate the bed so I'm kind of tall.
I know that the patients are right now, so do you know when you were born?
Just gonna move this out the way a bit. Alrighty. I just elevated you. I'm gonna put it back a bit, okay? Alright. Okie dokie. So I'm just gonna have your legs raised, okay? I'm gonna cover you if that's okay. Just gonna put your leg like this, your leg like this. Kind of provide some privacy for you. Wrap it around your legs. All right, you okay? Okay, so prior to this, I already did pericare. So what's gonna happen is I'm gonna start the catheterization. I'm gonna start setting up, and then I'll get with you, okay? So I'm just gonna bring my little desk over here, raise it up. Gonna start my sterile field. First thing I'm gonna do is take this bag out. Put the drainage bag lower. Just tuck it in here. I'm gonna use this later. Okay. And then I'm gonna use this for my garbage. So I'm just gonna put this down on this end. This is gonna be my garbage. Gonna collect all that stuff. Then I'm gonna get my sterile fill ready. Take this out the bag. This is going in the garbage as well. This is going to be used. This is all going to be used. So I'm opening this like so. Like so. I'm gonna put my sterile gloves aside. I'm gonna be using them later. Sterile field. Then there's that. Then I have my sterile field already set up here. On the doctor's order that I checked prior, there was no need for a specimen, so I'm just gonna put that aside. And then I'm gonna have this one I'm gonna use to clean the patient, even though I already did pericare. So what I'm gonna get over here is my normal saline. My normal saline it is not brand new, so I'm just gonna check the date. It's not expired, so I'm just gonna crack it open. I'm just gonna pour some off here because it's already been used. So now I'm gonna pour some in. So I broke sterile field. I put my bare hand in here. I know that, so I'm not gonna put my bare hand back inside. So I'm gonna pour this inside. This is gonna be used to clean the patient. This is gonna be put here. So this is all ready to go. So you're not experiencing any pain, right? I'm just gonna palpate your stomach here, just all the 4 quadrants. So, okay. Okay, everything seems cool, so I'm gonna continue. Everything's fine? Okie dokie. So, this is my catheter, which is going to be used. This is garbage. I have 2 catheters here, just in case one doesn't work, but one is here, but I'm only opening one right now. This is part of the sterile field I'm going to use a little later. This is my sterile field. Got I'm going to put this underneath, just in case we get a little wet. Okay, so that's there. Then I am going to actually get this sterile fill going, but I have everything set up. That's in there. So now I'm gonna don my sterile gloves. Everything else is going in here. So this is gonna go back here. I'm going to don my sterile gloves. This is the right hand is my dominant hand. So I'm gonna put it on like so. I'm not gonna pull it all the way down with my other hand, my left hand, because it's not sterile. I'm gonna take this hand, pick it up with this. I'm gonna put it on. Everything's okay? Come on. Then put this down with this. Then I'm gonna put this on. So now my sterile gloves are on and ready to be used. So I'm gonna extend my sterile field like so. Shiny part goes down. Alrighty. Then I'm going to put this on just around vagina area, like so, secure. Then I'm going to bring my sterile field in. What I'm going to do first before I actually bring this in is I'm going to take this out, put it into the garbage, and I am going to lubricate 2 to 3 inches because it's a female. Then I am going to bring this sterile field in to start the catheterization. Okay? So the first thing I'm gonna do, I already lubricated. So now what I'm going to do is I am going to clean the vagina area. So I'm just going to hold it open. Then I'm going to take 3 cotton to clean, top to bottom. This goes into my garbage. Another one, top to bottom. This goes into my garbage. Then I'm going to get this last one and clean inside. And that is going to my garbage. Okay. Then now I'm going to actually connect catheter to be used. It is filled up to 10 cc's. I'm going to only use 5. So this is like so. Now, since it's already lubricated, I am going to ask Mrs. Smith to bear down. Now I am going to, I broke sterile field. This actually should only be here, not be actually touching, because this is my sterile hand. This is no longer sterile. So this hand is going to stay here, and only sterile things are be touching with my right hand. So I am going to insert it inside and bring this a little closer. Insert it inside till I start to see urine. 2 to 3 for females. Okay, I start to see some urine. Okay. Now I'm actually going to inflate the balloon, going up to 5. Okay, gonna pull back a bit. Okay, it's inside. The balloon is inflated. Now I'm going to take this off because I no longer need it right now. And then now I am going to use my sterile hand. This is hand, but I'm going to grab this and I'm going to take off the cap. Still maintaining the sterile fields and being sterile, and put this on. kind of get it to an angle. Okay, it is on. Beautiful. Now I have my tape here, and I'm going to tape this to the leg so it doesn't move around and it stays where it's supposed to be. Then after the catheterization, then I would go back in and I would have to remove the inflation, but that's going to stay there because catheterization is being done. So I'm going to happen now, because she's already taped, I'm going to clean up. So this is all going into my garbage now. I'm going to take off my sterile gloves. And I'm going to remove this into my garbage. This is all garbage. And I'm going to put Mrs. Smith back into a comfortable position, reposition her. The legs are going to go down. This is going to stay. Everything okay? You're not feeling any pain? Okay. And then I'm going to reassess. Everything's going good. Urine is now flowing into the drainage bag. And I'm just going to reposition you. I'm going to put you down, clean up. I'm going to document the amount of drainage that I saw that was into the container. Wasn't that much drainage, but it's okay. We're going to come back and reassess within an hour. I'm going to close this down. Then I'm going to perform hand hygiene. Now I'm going to clean up everything in the garbage. Put the bed down. Okay, is that a comfortable position? Okay. And I will come back and reassess with you in an hour. And that's it.